Surgical care has been afforded low priority in the world's poorest regions, leaving 5 billion people without access to safe, affordable surgical and anesthesia care. Patients requiring surgical treatment will face multiple hurdles: delay in seeking care, delay in reaching care, delay in receiving care. To save lives and prevent disability, an additional 143 million surgical procedures are required annually in developing countries. Today's surgical workforce would need to double in 15 years. Investing in surgical services is affordable, saves lives, and promotes economic growth, making surgery an indivisible, indispensable part of healthcare.
One of the biggest needs for healthcare around the world is surgery. There is a lack of surgery, and surgery is the only way to treat either congenital heart disease or acquired heart disease, such as rheumatic heart disease. Rheumatic fever in Africa, as in Asia, remains an endemic disease which is not being treated prophylactically. Young children, adolescents, adults die daily due to heart failure in relation with their valvular heart disease, which is in itself due to untreated rheumatic fever. We have made the choice of building a surgical facility in Senegal because it's a wealthy, stable, and developing country in this area of Africa, which is West Africa. Originality of this project is that there was no structure dedicated to cardiac surgery previously. So there was a partnership between the public hospital, the CHU, who gave the land, and from scratch a building was built within less than 2 years' time. And this building was made on purpose at a reasonable size, not too big, not too small, in order to match the requirements and the needs of this country.
Senegal, oh Senegal, mon pays, ma patrie, Senegal. Peuple d'un peuple, à deux briques, une fois. Pays d'un peuple, à deux.
On the architectural standpoint, there are no lifts, no floors, no false ceilings, in order to contain the cost and the maintenance of the building. The facility in itself was quite expensive, many million euros, and fully equipped with the most modern and updated electronic equipment such as echo machines, heart-lung machines, monitors, electric syringes, portable radio machine, and so forth. Even more recently, we have provided them with one of the most updated software electronic way to monitor the patient's life from the moment they step in the hospital to the moment they come out. And you can not only follow the patient, but you can also track what was the consumable and the disposables being used for a given patient. And of course, in the future, the idea is that with these data, there will be publications derived from an experience which is quite rare, even around the world, with rheumatic fever. A lot of space, a lot of room, with a huge waiting room for the families, mothers and parents of the children. Some outpatient clinic offices with echo machines, a few offices, and also a staff and a meeting room. And on the other side, there are the treatment facilities, I would say. 2 operating rooms, very big size in order to decrease the risk of infection. 2 heart-lung machines, and at the end, down the corridor, there is the intensive care with 8 beds of intensive care with electronic monitors, electric syringes. Next to the intensive care is the in-hospital ward with 12 beds. Normally, given the activities and the requirements in cardiac surgery, with such structure, up to 800 open heart surgeries could be performed yearly. This year, the center, which has begun its activity in 2017, will celebrate the first 1,000 patients operated locally. And what is very special and has to be outlined is that these patients have been operated by local surgeons trained in different countries and who are treating their own patients without any support from outside. The support we give are only advices, some missions coming from different countries such as Canada, Switzerland or France from time to time, but never stay more than a week. And of course, financial support, because for all these countries, funding is a big problem. We have to understand that if a country like Senegal doesn't have a structure like that, the only way to treat a child who is dying from rheumatic heart fever or congenital heart disease is to send him abroad, either to Europe or to North Africa. And then you need to find the funding, you need to find the team, you need to find the right timing, and usually a lot of patients die. And if you treat patients like that, you will scratch the surface of the problem. You will not deal with the problem. A hospital like that deals with the local problem. And not only the problems of Senegal, but the problem of the adjacent countries such as Burkina Faso, Mali, Cameroon, and other countries where there are no such facilities and no such trained physician. So this hospital is a pride for Senegal, a pride for the Cuomo Foundation. Once you have a structure like that in a hospital, the level of the whole hospital raises. Why? Because cardiac surgery is not limited to cardiac surgery itself. Cardiac surgery involves coagulation, transfusion, bacteriology, renal failure. All these specialties raise their levels along with the cardiac surgical unit. We think we have provided a unique example in between North Africa, where there are some structures running quite well, and South Africa, there was virtually nothing. So we have created a unique example of something which works, which is efficient, and is autonomous. And this is something that we hope our colleagues from Senegal are conscious and are proud of, as we are proud of this hospital which we created only a few years ago. We hope that this structure will grow as much as we expect it to grow, and will improve results, capacity and efficacy, and perhaps one day there will be structures such as this one in other countries. But for the time being, our goal is to still support them, help them, advise them as much as they want. The message we want to deliver today is very clear. In a little time frame, we were able from scratch to build a structure which is similar to the one we can find in Europe or in America, and allow local patients with local physicians to deal with their own pathology. It is our pride, and we are happy that we have achieved that.
Senegal metti la ñuy way ay jamono ba tey bés bu nekk ak nakar yaakaar yi di gën a seey sunu njiit yeeg seen politique yu dëng ñu yàgg rey kilifa diine yeeg sunu bàyyi leen si lañu tey jamonoy twist neexoon na ku nekk sa bàyyi nee na féexoon na am liggéey yomboon na su la neexee sax am ñaari soxna dund boos lamb sa poos soo amee soxla ndekki mburu añee ceeb reere soos ku ñaan mu jox la ku nekk di ndamoo sama maam xeexoon na lu mu la bàyyi loon ci ndono laataa muy dee jeexoon na ana ngëm gi jikko yu baax yi lan ngeen ju sedd ñàkk seen ngor ndax alal bu kenn yaakaar ñu bàyyi mu sedd ndax seen jamono si la lépp tàmbalee dox caaxaan dab leen ba aveniru jeunesse bi di soox ñu mel ni jàmbaar yu ay agresseur futti doon ñu nangu nekk gaynde sunu njiit yi doon bukki doyaloon si nguuru nduuf moo tax ñu fal la tey dund bi gën a tax ko suuf li daw si dëkk bi